Aspirin, a standard treatment for the prevention of recurrent acute ischemic strokes, by Monica Keller. What is aspirin? Aspirin is the drug class known as nonsteroidal anti-inflammatory drugs, also called NSAIDs. NSAIDs have some chemical differences, but all of them are used to treat pain, fever, and inflammation. NSAIDs are also known to increase the risk of bleeding due to their ability to prevent blood clots. Aspirin is used in acute ischemic strokes. Acute ischemic strokes are also known as cerebral vascular accidents, CVAs. This occurs when a blood clot is lodged into the blood vessel of the brain, causing blood flow to be decreased within the brain or causing no blood flow at all. Aspirin is an antiplatelet, and it has the ability to help or to stop these clots from forming so that they don't become lodged into the brain's blood vessels. Comparison of the two drugs used in the treatment of ischemic strokes. The two that we're looking at is aspirin and low molecular weight heparin. The mode of action for aspirin is that it inhibits certain chemicals, and one of those is the thromboxane A2, a vasoconstrictor and a stimulator of platelet aggregation. It also inhibits prostaxylin activity, in which also inhibits platelet aggregation. The mode of action for low molecular weight heparin is that it reduces the growth of thrombin, and that helps to prevent the formation of fibrin, which also decreases chances of clots. The drug interactions with aspirin would be anything that would increase bleeding, such as NSAIDs or anticoagulants. And that would be the same for the low molecular weight heparin. You don't want to give that drug with any additional anticoagulants or NSAIDs, as that too will increase your chances of bleeding. Aspirin has been shown to be efficient in the prevention of recurrent ischemic strokes, whereas the low molecular weight heparin has shown to be efficient in preventing venous thromboembolism after ischemic stroke. Aspirin is a relatively safe medication to give if not given with other medications that will increase its risk of bleeding. Low molecular weight heparin is safer to give than unfractionated heparin in that it has a lower risk of developing heparin-induced thrombocytopenia, also known as HIT. The cost of aspirin is pretty inexpensive. You can get it over the counter, and it's less than $10 a bottle, whereas the low molecular weight heparin is significantly more expensive, with the cost of one dose being about $24.34 a dose. Your expected outcome with aspirin is to reduce the recurrent ischemic strokes, and the expected outcome with the low molecular weight heparin is to prevent venous thromboembolism after ischemic stroke. Acute ischemic strokes are the leading cause of adult disabilities, and it's the fourth leading cause of adult deaths. The use of aspirin has shown to reduce recurrent acute ischemic strokes. By administering aspirin, we will reduce patients' risk of repeated strokes and increase their chances of optimal recovery. Thank you.